14 years old, diagnosed with anorexia nervosa. This is a 14-year-old young woman who had an eating disorder. This was about a year before her weight fell to 58 pounds. 1 year before her mother drove her to an emergency room after she passed out, and 1 year before a doctor came into that emergency room and explained that her oldest daughter may only have a few more days to live. You might not recognize her, but the girl in that picture is me. The doctor hadn't been exaggerating. I was dying. Nearly every system in my body was shutting down. A valve in my heart was leaking. My skin was yellow from liver failure. I'd lost so much muscle tone in my bladder that I was in diapers. The doctors were alarmed at my condition, so they called Child Protective Services. A judge deemed my mother an unfit parent, and I've got to take a breath. A judge deemed my brother an unfit parent, and the hospital was given guardianship, which ended up being a blessing in disguise. I spent 18 months in the hospital. The doctors and nurses became my foster family. So a year and a half later, when I left, you would think I would be better. You would think, all right, 18 months, you would think that would do enough, but it wasn't. When I left the hospital, I was on 14 different medications, about half of which were psychiatric drugs. I was in a body that was twice the size of what it had been when I went in, and I was still underweight. I was having panic attacks, and I was having bouts of depression. I had a long way to go. For years after I kept my past a secret, I was ashamed. I thought if anybody ever knew about my illness, they would judge me and they would think me a lesser human being. I also didn't have a lot of hope about the future. I'd been told by therapists that eating disorders are chronic conditions and that I should be vigilant of a relapse. I had met women in the hospital who had had eating disorders for more than 30 years. They told me it never completely goes away. The year after I left the hospital, I decided to go to university to study neuroscience. I wanted to figure out what had gone so wrong in my brain. I wanted to understand what in the brain causes mental illness. How had I gotten so sick? One of the first things I learned is that neuroscience doesn't have a lot of good answers to that question. I had wrongly assumed, like many others, that mental illness comes from chemical imbalances in the brain. But it turns out that theory has been debunked for decades. Researchers widely agree that there's very little evidence to suggest serotonin, depression, or other mental illnesses comes from a lack of serotonin. In fact, we can't use biomarkers to diagnose any mental illness. So what that means is you can't do a blood test to figure out if somebody has schizophrenia, or you can't test 20 people's brains and figure out which one is depressed. That's not to say mental illness is not real. But psychiatric diagnoses are based on clusters of symptoms, not chemical imbalances or broken circuits. Another thing I'd assumed, I always thought that mental illness was a disease. Like I'd heard addiction was a disease and depression was a disease, but it turns out, again, I was wrong. They're not diseases, they're disorders. And while many of us use these terms interchangeably, they actually have different meanings. A disease is when something goes wrong and you can identify the biological process that's causing it. So cancer, for example, is a disease of unchecked cell growth. A disorder, on the other hand, is when something goes wrong, but we can't pinpoint or identify the exact biological process that's causing it. Sometimes disorders turn out to be diseases, but sometimes they're caused by other factors. It's a less precise diagnosis. Now, while I was busy searching for the causes of mental illness, I was still trying to reconcile my own challenges. A couple months after my 20th birthday, my biological mother was diagnosed with Wernicke-Korsakoff syndrome, alcohol-induced dementia. Things got rough. I started to slip back into old patterns of starving and sleeping the days away. I called the doctor who had been in charge of my care to see if I could come in for a visit. I trusted him. I broke down. I said, I hate my life and I hate myself. I feel like I've got a broken body and a broken family and a broken brain, and I'm going to struggle with this forever, and I'm tired. I don't want to do it anymore. He said to me something I will never forget. He said, Chelsea, you're not broken, and you're not always going to struggle with this. You're struggling with it now, and that's okay, but you will not always have an eating disorder. I know you. You can integrate this into who you are, and you will be a better person because of it. Those words changed my life. Up until that moment, I had never even considered the possibility of not having an eating disorder. I mean, I was hopeful for recovery, sure, but to me, recovery didn't mean being free of an eating disorder. It meant managing it. It meant looking in the mirror for the rest of my life and hating my body but not acting on the thoughts. It meant looking at a plate of food and not wanting to eat but eating it anyway. My diagnosis had come to shape how I saw myself and how I thought about the future. And the future, until that moment, was bleak. Now today, I run a nonprofit organization that helps people overcome mental health challenges. I've been on both sides of the system. I spent my childhood as a patient in the system, and I've spent my adult life helping people overcome these challenges. I've heard stories from thousands of people dealing with everything from anorexia to opiate addiction to schizophrenia. And one thing I hear over and over again is that they believe they have a disease they'll struggle with the rest of their lives. And they don't just get that idea from medical professionals. Often it's expressed most ardently from the people around them, from fellow sufferers. I've started to wonder, what if that idea might keep people sick? And what if the opposite idea, that mental health challenges are normal and that overcoming them is not only possible but probable, could help people get better? Now, back at university, my search for these causes was not going well. I kept getting sidetracked. I was in class one day, and a professor was giving a lecture on a controversial meta-analysis that suggested antidepressants work no better than placebo. Now, I was skeptical. I raised my hand, and I was like, I'm sorry, but if antidepressants don't work, how do you explain the fact that hundreds of thousands of people, if not millions of people, report positive benefits? Like, maybe this researcher's methodology was flawed, maybe he cherry-picked his data to justify his own conclusion. The professor smiled. He said, Chelsea, he's not saying antidepressants don't work. He's saying that the placebo effect works just as well. That floored me. Like, how is that even possible? How could the mind create those types of benefits? That doesn't make any sense. And so I got obsessed. I just inhaled the research on the placebo effect for a while. My favorite study compared a group of 150 patients who had torn their meniscus. So it looked at knee surgery versus placebo in a group of these patients who had had a knee injury. Half of the patients underwent the real surgery. The other half merely had their knees cut open and sewn right back up. Nobody knew whether they were getting the real surgery or not. Yep, okay. It gets better. So the results, though, were extraordinary. 1 year later, no one knows whether they're going to get the real surgery. 1 year later, the people who got the fake surgery were walking better than the people who got the real surgery. 2 years later, no difference between the groups at all. So the way this was reported in the press is, don't do knee surgery doesn't work, which is okay. I mean, I guess you could extrapolate that from that. But it wasn't that the knee surgery didn't work. It was that both the placebo and the knee surgery worked. Both made these patients walk better and have reduced pain. I mean, that's amazing. Okay, so you might think in your head, okay, so the placebo is when you can think yourself into feeling better, right? That makes sense. Except it's not that simple. It's not just in your head. So there was another study that found, oh, I love this one. It found a saline injection, so salt water. A saline injection not only improves motor skills for people with Parkinson's disease, it also makes these patients produce more dopamine, the very neurotransmitter Parkinson's disease destroys to begin with. It gets better. You can increase the effectiveness of a placebo simply in how you deliver it. So in most cases, the larger the pill, the stronger the effect. 2 pills work better than 1. Injections work better than pills. Surgeries work better than injections. There is even evidence to suggest that the color of the pill makes a difference. So colored pills reduce pain more than white pills. Blue pills will help you sleep better than red pills. Green pills are particularly effective at reducing anxiety, which is why I should have taken the green pill. So all of this tells us something very, very important about the mind in medicine. Our minds, and in particular our beliefs and expectations, can help us get better. But it turns out our minds can also make us sick. So I soon stumbled onto the placebo's evil cousin, the nocebo effect. The nocebo effect is basically the opposite of the placebo effect. Just as positive expectations can invoke the body's innate capacity for healing, negative expectations can cause side effects and symptoms to arise. So if I were to give you a pill right now and say, be careful, this might cause you to break out in a rash, you might really break out in a rash despite the fact that it's a sugar pill. I mean, that's amazing, right? There was a case study. There's a case study of a guy who managed to overdose on sugar pills. He was in an antidepressant drug trial, and he was rushed to the hospital one night with rapidly dropping blood pressure. He'd had a suicide attempt, only to find a few hours later that the medication he had overdosed on had been a placebo. Despite the fact that he'd taken 29 sugar pills, his body responded as if the pills had been real. I know, I mean, this blows my mind. And it blew my mind then too, because I started to think, if a placebo can make you better and a nocebo can make you sick, could a diagnosis cause a similar phenomenon? Could a diagnosis of mental illness cause negative effects? This brought me to what I've come to think of as the diagnosis effect. Today, I want to suggest that some of the ill effects we associate with mental illness, with mental disorders, aren't just due to the disorder itself, but to the beliefs and behaviors that emerge from a person and those around them in response to the diagnosis. It's not just that the belief you have an illness makes you sick, it's that a diagnosis, and in particular the narrative that comes along with a psychiatric one, changes how you think and feel about yourself. That, in turn, changes how you act, and those changes over time can extend and turn up the volume on the very problem you had to begin with. I see this happen in my patients all the time, my clients all the time. My number one job, and we can't get to anything else until this is done, is to help them release the deep-seated belief that they're broken and that they will never get better. To help them start to imagine a different, a more humane, a more expansive vision of who they are, how they've come to develop these ways of coping, and what's possible for them in the future. Diagnoses become part and parcel with identity. You're not just a person who's learned to cope with alcohol, you're an alcoholic. You're not just a person who hears voices, you are a schizophrenic. Those labels change how you feel about yourself and how you relate to others. I saw this in my own experience. I felt broken. I didn't date because I thought I was too unstable for a relationship. I didn't go out for beers with friends because I was told eating disorders are another form of addiction, and if you're not careful, you'll become an alcoholic. I didn't travel because I thought I was too fragile, which is funny now because I spend most of my life on the road. It seems silly, but back then I didn't question it. It was the narrative I've adopted with my diagnosis. I am not saying that these illnesses aren't real, not at all. What I'm suggesting is that these illnesses are made worse by the narratives that come along with them. When we talk about mental illness as a chronic, unrelenting disease, when we talk about people as powerless, when we suggest without good evidence that these people are doomed to a poor prognosis, we turn a person's own mind against them. Now, at this point, you might be thinking, okay, so are you suggesting that we just do away with diagnoses altogether? Like, that's an interesting idea. I'm not suggesting that. I mean, can you imagine what would have happened if my mom had wheeled me into that emergency room and the doctor had said, oh, well, something definitely appears to be wrong, but I don't want to tell you what it is because I might make it worse. No, a diagnosis can help medical professionals identify a problem and plan an effective course of treatment. I'm also not suggesting that we should simply think more positive about mental illness. I mean, wouldn't that be a mess? You walk into a psychiatrist's office, tell her you're thinking about taking your own life, and she says, you really just need to look on the bright side, like this mental illness thing is all in your head? No. Negative expectations can make us sick, but it doesn't follow that positive expectations alone will make us better. If it was that simple, if it was as simple as that, we would have solved our mental health crisis a long time ago. My doctor years ago gave me a key. He shared his belief in my ability to get better. I needed to believe it myself to walk through the door. It wasn't long after that I took up the practice of meditation, and it was in meditation I had a life-changing realization. For years, I had felt like a passive observer in my life. It was like I was in a car, and I was definitely in the driver's seat, but I wasn't holding onto the wheel. And I didn't even know there was a wheel, to be honest with you. It was like, why is this car going all over the road? And I was sitting there in meditation, and I realized, oh my gosh, this is my mind. These are my thoughts. I can redirect them. I can take the wheel and redirect the car. In fact, I'm the only one in here. I'm the only one who can. This is a concept social scientists call agency. Agency, if you've never heard this term before, is your felt sense of your ability to influence your thoughts, feelings, and actions. It's the feeling you're in the driver's seat of your own life. It's agency, not positive expectations, that's the antidote to the diagnosis effect. Agency takes positive expectations one step further. It's not about believing something good will happen to you. It's about believing you have the capacity to bring something good about. It takes the placebo effect one step further. It's not about believing something good will happen. I just said that. It's about believing you have the ability to bring something good about. The reason I think mental illness is so intractable is that it hijacks a person's sense of agency. It's not that people don't want to get better, it's that they don't feel that they can. And here's the thing, our prevailing narrative of mental illness runs in direct opposition to building a sense of agency. It says, this is happening to you, you have a disease, you can't trust your mind. That's so problematic because, in my experience, overcoming mental health challenges is an active process. It requires your participation. It requires more than anything you trust your own mind. I mentioned earlier I now run a nonprofit, and if you're thinking this agency thing sounds good, but what would that even look like? I want to give you three things I've seen work in the nonprofit. One is mentorship. Surround the person who's struggling with living, breathing examples that overcoming these challenges is possible. Don't just surround sick people with sick people. Two is mindfulness. Teach the person practical skills for managing their own mind. Yoga and meditation work very well, and they don't have side effects, which is awesome. Yoga and meditation are no panacea, but they can help traditional treatment work better. Last but not least, service. Get the person involved in volunteering and service activities immediately. This gives them a lived experience of their ability to have an influence, to make an impact, not only on their own life, but on someone else's. This is why I'm standing on this stage today. It's time we turn away from the idea that people with mental illness are sick and diseased. And it's time we turn toward the idea It's time that we turn toward a more expansive, a more humane, a more nuanced vision of the mind and what's possible. Thank you.